Today we'll be discussing retirement and health insurance. We'll begin with the basic Medicare components. The four parts of Medicare include Part A, Part B, Part C, and Part D. Part A of Medicare helps pay for inpatient hospital stays, and Medicare Part B covers outpatient visits. Medicare Part C is commonly known as Medicare Advantage, and Medicare Part D helps cover prescription costs. Medicare Part A has a $1,600 deductible for the first 60 days and a coinsurance of $400 per day for days 61 to 90. There is no premium for Medicare Part A. Medicare Part B has a standard monthly premium of $164.90 and a deductible of $226 for the year. Part B also has a coinsurance of 20%. Now let's discuss what happens when you are Medicare eligible but continue to work. You can delay your enrollment in Medicare if you plan to continue working and keep SEHP benefits. If you continue to work, your SEHP benefits will be your primary coverage, and Medicare will be your secondary coverage if you choose to enroll in it. 60 days before you become Medicare eligible, the SEHP will contact you by email with notification that you will need to complete a TEFRA form, which confirms your election to keep SEHP benefits, or drop SEHP benefits and enroll in Medicare. SEHP will contact you by email. If you enroll in Medicare Part A and are enrolled in Plan C or Plan N with a Health Savings Account, HSA, you must stop all HSA contributions as of the last day of the month prior to your Medicare effective date. A Health Reimbursement Account, HRA, for employer contributions only can be added to replace HSA contributions. You may contribute and use a Medical Flexible Spending Account, FSA, with your HRA. If you are currently contributing to a healthcare or limited healthcare FSA, you will have 90 days from the date of retirement to use the funds for eligible medical expenses that were incurred while you were actively employed with the state of Kansas. We'll talk now about retiring when you are Medicare eligible. The Centers for Medicare and Medicaid Services, CMS, requires enrollment in Parts A and B and D of Medicare upon retirement. The CMS website provides more information about applying for and enrolling in Medicare. You will also need to check with the Social Security Administration to verify when to apply for Medicare and when it will take effect. If you waive all parts of Medicare, A, B, and D, and are enrolled in Plan C or Plan N with an HSA, you can continue to contribute to your HSA. If you are over age 65 when you first apply for Medicare, your Medicare effective date may be backdated approximately 6 months, but not prior to your 65th birthday. As of your Medicare effective date, you will need to stop your HSA contributions. Continuing to contribute to an HSA while on Medicare may result in IRS tax penalties. Direct Bill is the program offered by the SEHP that allows you to continue with state health insurance whether you are Medicare eligible or not. When you decide to retire, you will need to notify your Human Resources Office so that they can notify the SEHP of your retirement. You may elect to discontinue the medical coverage and continue your dental or vision insurance through the SEHP. If your enrollment in the SEHP medical or dental plan is discontinued, you cannot elect it again later. Open enrollment for Direct Bill takes place each fall and allows you to make plan changes for the following year. Direct Bill offers both Medicare and non-Medicare plans. Non-Medicare plans include BCB SKS or Aetna plans A, C, J, and N, which include the standard Caremark prescription drug coverage. Medicare options include BCBS Senior Plan Medicare Supplement plans, Aetna Medicare Advantage plans, which include the Aetna Standard Part D prescription plan, Part D prescription plans through SilverScript, and Delta Dental Plan and/or Avisus Vision Insurance. Enrollment in the SilverScript Medicare Part D prescription plans requires enrollment in a BCBS Medicare Supplement plan. Many SEHP members have mixed eligibility that requires a split enrollment, which means that each member enrolled in an SEHP plan may have a member-only enrollment. All Medicare plan members will have member-only enrollments, which is a requirement of Centers for Medicare and Medicaid Services. Medicare requires enrollment in Part D prescription drug coverage. Direct Bill offers Part D plans through SilverScript. Part D enrollment requires enrollment in one of the BCBS Medicare supplement plans. All state of Kansas drug coverage is considered creditable coverage, which means the coverage is as good as or better than Medicare prescription drug coverage. VA and TRICARE prescription plans are also considered creditable coverage. Low-income beneficiaries may qualify for a subsidy through the Centers for Medicare and Medicaid Services. When deciding on a Medicare Part D plan, it's very important to review the formularies and preferred drug lists to verify which plans work best for you. Most medications allow for a 90-day supply, which can help you save money on prescription drug costs, except for specialty medications, which can only be filled for up to a 30-day supply. The SilverScript Premier Plan, offered by the SEHP, pays through the Medicare coverage gap, which can help members who have high-cost medications. If you choose a SilverScript plan through the SEHP, invoices are sent directly by SilverScript. Kansas Senior Plans are Medicare supplement insurance plans offered through BCBS of Kansas. They are designed to coordinate with traditional Medicare coverage. Supplement plans pay the Medicare Part A deductible and coinsurance. Unlike most Medicare supplement plans available in the open market, the SEHP's Kansas Senior Plans are not age-rated. Premiums are reviewed annually and adjusted, but don't increase just because you have a birthday. Except for Kansas Senior Plan C, members are required to pay the Medicare Part B deductible. Enrolling in a Kansas Senior Plan Select plan can help you save on your monthly premium. To enroll, you must live in specific counties in Kansas and are required to use a network hospital for any non-emergent inpatient service. The Kansas Senior Plan insurance options allow you to choose from Part D prescription plans offered by the SEHP, or you can elect to choose a Part D plan on the private market. You may elect to have dental and vision insurance. Reminders: your spouse or dependents are covered under separate enrollments with SEHP. You will want to look for doctors and hospitals that accept Medicare assignment. Medicare Advantage plans are another way to use your Medicare benefits. Advantage plans combine Medicare Parts A, B, and D, but you are still required to enroll in Medicare A and B. Advantage plans are offered by the SEHP through Aetna and include the Aetna Standard Part D prescription coverage. Advantage plans offer additional benefits than Medicare alone, including Silver Sneakers gym membership and a hearing aid allowance. Once you decide to retire, contact your Human Resource Office and let them know your health insurance plans. Your HR representative can help you through the process of enrolling in Direct Bill if that's what you choose. COBRA paperwork will be mailed to your address even if you are not electing it. There are many things to consider when you retire. When looking at the different plan options, remember to look at copay, coinsurance, and deductible amounts. If you elect to go to the marketplace for coverage, verify how your premium is determined. Is the plan age-rated, where the premiums increase as you age? What is your potential out-of-pocket from deductibles, coinsurance, and copays? What is the plan's out-of-pocket maximum each year? Take into consideration your personal preferences, lifestyle, travel plans, and where you will be living when you retire. As a reminder, if you drop the SEHP's medical plan, you may not re-enroll later for the SEHP's plans. There are many resources available to you to help guide you in making the best decision for your specific health insurance needs. The Direct Bill call center is available to help during open enrollment, but you can call anytime during the year. The Direct Bill phone number is 866-541-7100. Thank you for your time, and please contact the Direct Bill call center if you have any questions.